name once again is Nurse OLUWAKEMI IBULUBO. I'm going to be taking the topic nursing care of preterm neonates. First and foremost, I must let us know that nursing care is crucial for preterm neonates due to their increased risks of vulnerability and complications. So this is the table of content. We have a case study. Yes, these are case study. This is one of the preterm neonate that was successfully managed in our facility. The baby name is baby XX. Gestational age 29 weeks plus 4 days. Mode of delivery is vaginal delivery. The sex is female. The birth weight is 1.3 kg. This is a very low birth weight. The APGAR score is 7 and 10 in 1 and 5 minutes respectively. So we also want to emphasize that history taking is very essential, because in assessment and planning the nursing care for these babies, it is very, very essential. So we've seen the case study. The baby is at risk of, I know we've mentioned the risks in the previous lectures, and if we are actively listening, I know by now we should be able to guess. With this presentation, baby being 29 weeks plus 4 days, a preterm, what this baby will be at risk of. I don't know if the audience can help. What is this baby at risk of? Just a quick one. Thank you. I'm hearing respiratory distress. What again? Sepsis. Yes? Hypothermia, thank you. So baby is at risk of hypoglycemia because we know that the glycogen is limited. And also the baby is going to be at risk of hypothermia. The first one we said hypoglycemia because of the limited glycogen store. The second one, hypothermia, because of the lack of subcutaneous fat. And the other one also, respiratory distress syndrome. We've talked about airway, how to manage airway, how to make the babies breathe. So this is also very, very essential. The baby is at risk of respiratory distress syndrome because of the insufficient level of surfactant. And neonatal sepsis. Baby is at risk of neonatal sepsis due to the immaturity of immune system. And the baby is also at risk of apnea of prematurity because of the immaturity of the central nervous system. So we'll move on to the nursing goal. So when planning nursing care for this guest, it's important that we focus our attention on this, that the baby should be able to maintain adequate oxygenation and prevent respiratory failure. This is because we know that they are at risk of respiratory distress syndrome and the apnea of prematurity. And also, we want to prevent hypothermia and ensure stable temperature. We know that the glycogen store is not adequate, and most neonates, especially preterm neonates, are at risk of hypothermia. And that's why we want to ensure they have a stable temperature. And the other one is to maintain hydration. Want to maintain hydration of this baby because earlier we said that they are at risk of hypoglycemia. So we want the baby to be adequately hydrated, and we also want to prevent nosocomial infection, because the baby also is at risk of sepsis, as we've mentioned earlier. So nursing goal as well, to ensure that we monitor for apnea because of the apnea of prematurity. And we want to ensure, and this last one is very essential because we should not as well leave it aside. This is because of the child and mother separation. So most parents are anxious, they need to be carried along, and we want the care to be patient-centered care. We are in an era where they have the right to know what their child is being managed for, the management, and for them as well to participate in the care of their child. So we want to provide emotional support, we want to reassure the parents, we want to give them adequate information, educate the parents, most especially the mothers, and also to give patient-centered care. So here are the nursing intervention. We've already set our goals, and the next is for our intervention, which is for to ensure adequate respiration. So the first thing we do is to review the basic newborn history. History taking is very essential. We want to find out the gestational age of the baby. For the case study, we said the child is 29 weeks and 4 days. The child is a premature baby. And the weight of this child said 1.38. Those are the key things we should note. And also assess for signs of respiratory distress. Whether the child is breathing spontaneously, whether the child is having labored breathing, whether the child is having apnea, cessation of breathing, and also want to assess gasping, whether the child is gasping, and be able to intervene effectively. So the airway also, we want to sanction the child. And the first thing when you are taking care of the airway is to position the child appropriately in a neutral position to facilitate breathing, and also to sanction. I know Dr. Peter mentioned that the secretions you can see should not be too deep so as not to injure the child, but the secretions you can see that is obvious, you want to sanction at a pressure of 60 to 100 milliliters of mercury, and you want for the baby is going to be on CPAP to determine if the child is going to be on oxygen, because you want to ensure adequate oxygenation of the baby. So baby, you're going to put the baby on oxygen, monitor baby vital sign, the SpO2, the respiratory rate, the heart rate, and also while the child is on CPAP, we want to ensure that appropriate size of nasal prom is also very essential. You want to, for preterm neonate, there is a particular size of nasal prom that is advisable. You don't want to use an adult size for your preterm neonate so that you don't want to injure the child. And as well, sometimes while sanctioning, you can observe that the secretions, maybe you observe for dry secretions, is good as well. You instill normal saline to help lubricate and be able to sanction effectively. And as well, you can also irrigate every 4 hours while sanctioning the airway. So for the nursing intervention for thermoregulation, because we said they are at risk of hypothermia. So that's why where the incubator come in, we place the baby in a pre-warm incubator with adequate setting. There's a required setting for incubator to ensure optimal temperature for the baby. We want to monitor the baby's temperature. There are some incubators that you can assess the baby's temperature. All you need to do is just to put the temperature probe on the baby. at a glance, you can view the temperature of the baby. So close monitoring of baby's temperature is very essential, the functioning, and also you want to assess the functionality of the incubator. And also, one thing as well, for preterm neonates, you temporize bathing. We said that the glycogen store is limited, and as well, because of the risk of hypothermia, you don't bathe like normal newborn term neonates. So you clean, but the babies needs to be clean. Their hygiene and their care is also important. So you clean daily with olive oil and gauze. Sometimes you might see some dry secretions, maybe on the lid, on the nose. You can as well lubricate with normal saline, ensure you clean. But baby should be properly cleaned with olive oil and sterile gauze. And as well, you want to initiate early KMC. Early KMC, kangaroo mother care, where the mother will place the baby just to ensure optimal temperature. So the sixth intervention, we've talked about airway, we've talked about thermoregulation. The next one is nutritional intervention, because neonates also needs to feed. Their nutrition is very important, and also we said they are at risk of hypoglycemia. So we probable initial parental nutrition. Probably initial parental nutrition, the child is going to be on IV fluid. And when the child is on IV fluid, you want to monitor the drop rate. You want to ensure that the drop rate is going at the right rate, and you want to ensure that the child gets adequate IV fluid as prescribed, and you assess also the rocking and suckling reflex. Some of these babies, even you can feel them sucking. Anything that comes close to them, they want to suck. You want to suck. That baby is already ready and prepared for feeding. So you want to assess the suckling reflex and auscultate for bowel sound. Also, you assess random blood sugar, because this child is on IV fluid. There's also is essential that when they are on IV fluid, you place them on infusion pumps that will help to regulate the drop rate of the preterm neonate. So this child is on infusion pump for close monitoring. You set the appropriate meals you are going to give the baby. So it's essential that we also monitor their random blood sugar to ensure that they are not getting excess fluid, and to ensure that they have optimal glycemic control. And also want to keep strict input and output charts, intake and output. The meals the child is taking, it must be properly documented. The urine, whether the child pampers is soaked, you want to be sure that the child is making adequate urine. And if there is also vomit or residual, those are part of the intake and output. You want to take proper inventory and chart record for this. And also daily weighing. You want to ensure that this child is gaining appropriate weight and the nutrition is adequate. So every alternate day is required that you check the weight of the babies. And when doing this, it's very important to use a particular scale at the same time of the day. If you want to check in the morning, for you to be able to ensure that the record is the same and there is no inconsistency with the weighing scale as well. So nasogastric tube insertion. The first intervention, child is going to be on IV fluid. When child is stabilized, gradually the child is going to be weaned off IV fluid, and even sometimes they might be on IV fluid and you have to commence oral feeding through the NG tube. And when the child is on NG tube, you want to, before feeding this baby, you want to ensure that the tube is in right place. You want to confirm the placement of the tube before feeding this child. And we know the various ways we can do that. By you can check through the given the NASA, you can check through the NG tube using a sterile or clean gallipot with distilled water to check for bubbles. When you know that you see bubbles, you know the tube is not in the right place, and that indicates that the tube has been dislodged or is in the airway. So before commencing feeding, this is very essential so that the child will not aspirate. You feed the required meals gradually as prescribed, and you assess for level of tolerance if there is residual when you're feeding. And as well, for the nutritional support, you can also fortification of breast milk. Even when feeding, the supplements can be added to the feed, like calcium, like Abidec, multivitamins, folic acid, just to ensure that the child is getting adequate nutrition. The next intervention, we talk about parental support and education. This is also very important because parents can be anxious. So you provide psychological support, reassurance, and regular updates on baby's condition. You want to inform the parents on the management of the child. You reassure them. Most times you let them know prematurity is not a as in there are positive outcomes. Babies have passed through prematurity and they come out well. You want to reassure them that their baby will be fine. You want to reassure them that their baby is in good hands, and you can also let them know the success story. Other babies that have went through the same and now they are doing very well. This will help allay the anxiety. And also, you want to regularly update them on the baby's condition, the management. Sometimes maybe they might need for blood transfusion. The consultants, the managing physicians, even as the nurse, you want to educate them, ensure that these parents are well educated on the baby's condition. And as well, you want to demonstrate to parents basic care, holding, dappering, turning, and feeding, especially when they comes in for some facilities where I know in NICU parents are not allowed to come in, and when they are gradually weaned off from NICU to the ward or the stable, when the baby is much more stable, when the parent comes for KMC, is an avenue for you to provide basic care on how they can change diaper, especially for the first timers, and holding, how to hold baby. Some parents can agitate and can be anxious even about holding because they are very fragile. I have a mother who was saying that the baby is so small to carry, but it's a child, she has to carry the child. So you want to educate them that's how to hold the baby, proper positioning, and how to change the diaper, how to turn the baby, especially when feeding this baby. And you want to educate them on preterm care. You want to educate them on preterm care. You want to educate them on feeding, how the child, when the child is weaned off NG tube and the child is being fed orally. Mothers too should be able to do that because when they go home, they should be able to feed their babies. So you want to demonstrate how to effectively feed their babies, what to watch out for, signs of aspiration, and necessary things to do when a child aspirated. And you want to give them proper education on infection prevention as well, how to properly wash their hands, babies' utensils, feeding cup, even before and after feeding, that meticulous hand washing, hand hygiene. For those who have caregivers, for those mothers, you want to also educate the caregivers because it's not only the parents alone. You want to educate the people, the caregiver that are managing, that is going to take care of this baby so that the child will be properly properly fed, and as well to ensure that the child does not come down with infection. And you want to encourage early involvement in care when, as much as possible, when the child is much stable. You want to introduce KMC when the child is stable, and the parents will come in, the mother, the father also can participate in KMC, and that you increase the bonding between parents and child, and as well they can participate. There's this joy when the mothers. Okay, thank you. There's this joy when a mother participates in the care of their child. So other nursing care, of course, when this child is in NICU, you want to ensure that the child is properly, identification tag is put on the baby to ensure that the child is properly identified, and as well, you want to document every procedure that is being done on this guest, the nursing care rendered, and vital signs, alarm vitals. Proper documentation is very important. And so in conclusion, teamwork is necessary, is crucial in management of preterm. Both the doctors and nurses, they should work together as a team. And also, nursing attention is necessary in management of preterm neonates, so that they can able to assess them and document, and as well monitor for the respiratory care, the nutrition, and patient-centered care is the key. Thank you.